Hi, my name's Sophia. I am going to be your nurse today. I have a couple of your medications here that I would like to give you. I would also like to give you some education on these meds. So we will start with furosemide, also known as Lasix. This is a diuretic, specifically called a loop diuretic. It works in a certain spot in the kidneys, is why it's called a loop diuretic. So there's certain diuretics that will help you hold on to electrolytes such as potassium, sodium, etc. The loop diuretic does not hold on to any of that. So it can cause low potassium levels, so that's something we are going to monitor. The way that this diuretic works is it reduces the amount of fluid in your blood vessels, which helps to reduce the strain on your heart with the congestive heart failure. This can help alleviate your symptoms pretty quickly. It is administered in the morning typically because it does make you urinate a lot. So if you take it later in the day, you might be up at night having to use the bathroom. So we recommend always taking it in the morning. Some side effects you might have are hypotension, so low blood pressure. So definitely make sure you're monitoring your blood pressure at home. We will, of course, monitor your blood pressure and also your heart rate along with your other vital signs while you're here in the hospital. If you experience any muscle cramps, I want you to report that to the nurses immediately, as that can be an adverse effect. So like I said, I'll continue to monitor your vital signs. This will lower your blood pressure because it's taking extra fluid out of your blood vessels. So less fluid equals lower blood pressure, which is good because that is what we want. So let me know if you have any questions on that one. The next one I would like to talk to you about is Metoprolol. I believe the brand name is Lopressor. There's other ones out there though. So you are taking 25 milligrams twice a day by mouth. This is a beta blocker medication, so it works by lowering the blood pressure and your heart rate, which also reduces that need for cardiac workload. So your heart isn't working as hard when we slow the blood pressure and the heart rate down with this medication. So some side effects to be aware of are dizziness, fatigue, shortness of breath. I would like you to report those to us immediately if you start experiencing that. Something that is important to do when you're taking either one of these drugs is to change your position slowly. So if you're going to get up and use the bathroom, make sure you dangle your legs at the edge of the bed for a couple minutes so that your body can adjust and you won't have a drop in blood pressure when you immediately stand up. That's called orthostatic hypotension. So you become hypotensive or have low blood pressure when you change positions. So to prevent that, because these meds can and do affect your blood pressure, sitting at the edge of the bed with your feet dangling for a couple minutes usually helps resolve that problem. Just be very aware you might not be as stable as normal. So just be aware that you do have a higher risk for falls, especially here in the hospital. Let's see. Again, with this med, we'll also continue to monitor your heart rate and blood pressure. Those are really good indicators as to whether it is working or not, or if it's working too well, and then we need to adjust the dose, which I would reach out to the doctor and have a conversation about that. So that is about it for the medication on these two meds. If you have any other questions, please feel free to ask.